Hello friends. So today's daily clinical video series is about one topic: why certain patients don't want to give you proper history. So this is the topic. Most of the doctors and practitioners and even students have encountered this problem while taking a case that many of the patients they do not want to give history. So today's video is about how to approach these patients, how to observe, what to observe. So there are certain categories of patients who do not like to give history. Our case taking, as you know, is a very detailed, meticulous, and artistic procedure. In this case taking, we go deeper and deeper into the mind of the patient, but sometimes we do not get history even after probing so many times. So, how to get the information? Sometimes the information is in front of us and we fail to observe. So, either we fail to correlate the information given in the history, and which is very rare for an experienced and a wise homeopath. So, when the information is being provided and we fail to correlate, this is one aspect. So, this is very rare phenomena for a very wise homeopath because it rarely happens to him. Another thing is the patient does not want to give information. So, on this thing, I want to give you some tips. So, now let us discuss what type of personalities will not give you proper history. Number one personality is irritable and angry personality. So these people they hate answering questions. They feel very irritated when you ask questions. So rather than probing more and more, you need to focus on the body language of how the patient is reacting to, and always take the help of attendant. Confirm what you observe. If the phenomena is happening always, then this is very important. So there are few rubrics which you can take directly. Quarrelsome without waiting for answers. This is one rubric. The rubric is quarrelsome without waiting for answers. Second rubric is answering violently. So like the body language is like, what do you want? So this is like the answering violently. So answering snappishly, what is this doctor? What? I don't want to answer this. So this is snappish. Then answering, refusing to answer. No sir, I do not want to answer. This is plain and blunt. So this is answering, refusing to answer. Then answering monosyllables in. How are you? Fine. What are you doing? And what is your problem? So only monosyllables or yes or no or single word answer you will get. Then answering offensive. Offensive means ki you will feel very bad from inside. Why did I even ask this question to him? Suppose if you ask, how are you? Can you see? How am I? So this is like offensive. And you feel offended. And in this statement of the patient, one or two bad words may or may not be heard. So answering grunting by, answering civil cannot be. So these rubrics you can confirm with the attendants whether the patient is like this always or here only he is like this. So if he is always like this, then take the rubric. Then angry when obliged to answer. So these are few example of rubrics which you can take. Then non-cooperative patients who do not want to cooperate and wants medicine in shortcut. So they want medicine in shortcut. So mostly they are rebellious, they are revolting, they are very obstinate, and they are indifferent type of patients. So answering aversion to answer. Second rubric is answering indifferent. So they are not at all bothered. What is this doctor? Okay. Like this, they will be having their body language. Answering dictatorial, so like authority or like a commanding way they will be answering. Indifference when questioned to. So when you question them, they become indifferent. They have the aversion to answer. So these are the few rubrics which you can find or you can interpret from the body language. Then there are manipulative types. These are very difficult to handle because you don't know how they are manipulating you. So you need to confirm their things, each and everything with the person who has come. So send the patient outside and just let the attendant come inside and then talk to him nicely and try to find the what type of history you want and what exactly you want to confirm. So these manipulative type, they always want to keep a very good image, and mind you, these people have done some thing or the other thing which they want to hide and they want to manipulate. So answering evasively. So if you are poking the at the weak spot of the patient, so they will be answering evasively. So this is the rubric. Answering incorrectly. Okay. So there are many rubrics like this, but the help again should be taken from the attendant and you need to confirm it. Then there are hiding type of patients. So they are at the when they are at fault and they want to hide their weaknesses. Some of them, they have some extramarital affairs. They would have done some wrong things in the office, so they want to hide. And those things are bothering them also from inside, but they do not want to disclose it. So they are the hiding type of patients. And in that category, very emotional type of personalities also, who are very reserved. So they rarely show their emotion outside. So they will sit in the corner and they will think and weep, but they will not express anything outside. Then the egoistic type are there, who due to fear of losing image, they do not want to reveal. So these type of patients may rarely give you history. Then there are again the feeble-minded patients who lack intellect. So you keep on asking, but they will not think. So answering unintelligibly, then answering slowly. So the Baraitas and all, they are feeble-minded. Then there are certain people who are light-minded. Light-minded means they have a very shallow thinking process. So they will reveal the situation, but in that, what is their perception, they will narrate you in a very superficial manner. There will not be any depth. And even if you ask them the duration of their illness, they will think they do not want to use their brain. So they do not want to exert mentally. So these are the light patients who take things very lightly. Then there are suspicious type of patients who have trust issues with the doctor. So suspicion, considering everybody his enemy, is one rubric. Then suspicious friends is best, Crotellus, Cascavella, Drosera, Ruta, etc. are the remedies. So these patients are even suspicious of his friends. So if they are not trusting the friends, how they are going to trust you? So these suspicious type of patients, so you need to gradually make them come into your confidence. So it is how easily and how you try to be close to them and win their trust. So the case taking depends upon the time duration in which you win their trust. So suspicious, looking on all sides. See, if a person is like this, so he is looking on all sides. So this is Kali Brom. Then suspicious, medicine will not take, Simicifuga and Triticum vulgare. So these remedy, they will not take medicine because they are very doubtful. Then there are haughty type of patients who do not allow the physician to talk freely. So if a patient is like a very heavy type of personality, having a heavy personality, so he will not allow the physician to talk. So he will try to overpower him. So these are platina, ipecac, and viratrum. So these type of patients are there. So confused type who are not able to calculate what they want to say and what not to. So there are confused type of personalities. So they need help of some other person, and they always look to the other person for answering. Just like Illumina. Okay, when you ask Illumina, how are you? He will watch the attendant who came with him or her just to answer, because Illumina has a delusion that head belongs to another. So the thinking process is not whatever I am doing is I should do under the command of someone else. So this is the perception of Illumina. So confusion of mind calculating when. So Natramure, Naxomica, Soranum, Syphilinum and Vanilla. So confusion of mind calculating when. Calculating means any case taking. If you ask the person ki, what is the duration of your illness, so now think what is the conflict. So all these are calculations. It is not always the mathematics of calculation. Homeopathy itself is mathematics. So whatever exercise we are doing with the patient, that itself is mathematics. So confusion of mind calculating when. So there are impatient type who cannot wait for the case taking. So the last category is impatient types who cannot wait for the case taking. So impatience always mercury and silica. Impatience cure him at once doctor should is chamomilla. Single remedy chamomilla and a very beautiful rubric. Impatience cure him at once doctors should. Then impatience spoken to when lilium twig and naxomica. Then impatience trifles about. There are many medicines in this rubric. Impatience trifles about. So, so there are total 11 permutation combination of patients who will where you will find difficulty in collecting the right information and perception. So try to observe closely, and these cases actually, those who do not give you history, they will make you work harder. So never hesitate to work hard. And as Henneman has written in Organon, homeopathy is never for lazy people. So if we are lazy and we do not make efforts, so we will be failing. So we are, so friends and doctors, so we are here for a certain purpose, and we should pursue that purpose with certain amount of energy, and we should never be disheartened by anything, because success and failures are everywhere. So just keep on working, keep what you can do the best for the patient, never be disheartened by any failures. So doctors, thank you, and please like, subscribe and share as always you do. Thank you.